Welcome to Health Fact 10M.
Gentlemen, picture this. You wake up tomorrow morning with the kind of firmness you haven't felt in years. No pills, no pumps, no risky treatments, just your own hands and a few minutes of simple, precise stimulation to reactivate your body's natural erection mechanism. I'm Dr. Sarah, a urologist with over a decade of experience helping men reclaim their sexual vitality. And today, I'm going to reveal 3 powerful pressure points on your manhood and surrounding area that can help restore morning erections by improving blood flow, relaxing the right muscles, and boosting nerve responsiveness. If you've been missing that automatic morning rise, stay with me. By the end of this video, you'll know exactly where these points are, how to stimulate them safely, and how often to practice for real results. But before we dive into the where and how, let's talk about why this method works. Once you understand the science, you'll see that you're not just pressing on skin, you're tapping into one of the most powerful systems in the male body. Erections are not random. They're the result of a carefully coordinated process between your brain, spinal cord, blood vessels, nerves, and muscles. It all begins with nerve signals, tiny electrical messages that travel at lightning speed from your brain or sensory nerves to the erectile tissue. These signals tell the smooth muscles inside the penis to relax, which allows blood to rush in and fill the spongy chambers called the corpora cavernosa. As those chambers expand, the veins that normally drain blood away are compressed, trapping the blood inside and creating firmness. Here's where aging changes the game. Over time, blood vessels in the pelvic region lose elasticity, making circulation sluggish. Years of wear and tear, mild inflammation, or conditions like high blood pressure only speed this up. At the same time, nerve conduction slows, meaning signals don't travel as quickly or as strongly. Together, weaker circulation and slower nerve responses are a big reason morning erections fade after age 50 or 60. This is where pressure point stimulation comes in. When you press or massage specific spots, you activate clusters of sensory nerve endings that feed directly into reflex pathways controlling erections. Those signals travel to the pelvic nerve plexus and even up to the spinal cord's sacral region, where the erection center lives. This triggers a chain reaction. The nervous system tells smooth muscle to relax, arteries to widen, and blood to flow more freely. Some points also affect the pelvic floor muscles, the hammock-like muscles that support erections and help control ejaculation. Stimulating them improves tone and responsiveness, making it easier to maintain firmness once you have it. So, pressure point work helps in 2 ways. It makes it easier to initiate erections, and it helps you sustain them. Think of it as rebooting your erection system, refreshing the signal, clearing the lag, and letting nerves, vessels, and muscles work together again. With consistent practice, this technique can retrain your erectile reflexes, restore vascular flexibility, and sharpen nerve sensitivity over time. Now, let's go through the 3 pressure points. 1. The base groove. This lies at the root of your manhood, where the shaft meets the pubic area. Run your fingers along the underside of the shaft toward your body and you'll find a slight groove or hinge-like spot where the erectile tissue blends into deeper pelvic structures. This area matters because it's packed with sensory nerve endings, including branches of the dorsal nerve, plus key blood vessel junctions feeding directly into the erectile chambers. Think of it as a control hub for both nerve signals and circulation. To stimulate it, place your thumb over the groove while supporting the shaft with your fingers. Apply moderate pressure in slow circular motions, enough to feel the tissue, but never painful. As the tissue relaxes, gradually increase pressure. You may notice warmth, tingling, or fullness, all signs of increased blood flow. Do this daily, ideally in the morning before getting out of bed or in the shower when tissues are relaxed. With time, this retrains erectile reflexes and restores strong morning firmness. 2. The perineal spot. This is the soft patch between the scrotum and anus, directly above the bulbospongiosus muscle. That muscle acts as a natural clamp, trapping blood inside the penis during erections. With age, it weakens, making firmness harder to maintain. By pressing here, you reflexively activate and strengthen that muscle without needing full kegels. Sit or lie back with knees slightly apart. Using your index and middle finger, press gently but firmly into the center of the perineum. Move in slow circles for 2 to 3 minutes. You may feel warmth or pulsing, your circulation and pelvic floor waking up. For extra benefit, pair this with light pelvic floor exercises before or after. Done consistently, this builds stronger, more reliable erections. 3. The corona, gland ridge. The 3rd point is just beneath the head of the penis at the corona, the ridge where the glands meets the shaft. This region is loaded with nerve endings that send arousal signals to the spinal cord's erection center. Here, controlled stimulation works best. Using thumb and forefinger, gently pinch the ridge for 5 seconds, then release. Repeat for about a minute. Next, use slow circular motions around the circumference for another minute. The goal isn't intensity but steady reconditioning of the nerves. With time, this improves sensitivity, strengthens the arousal to erection response, and restores spontaneity. The routine. For best results, perform all 3 points as a sequence. Base groove, 90 seconds of circular motions. Perineum, 2 minutes of steady massage. Corona, 2 minutes of hold and release plus circular strokes. This routine stimulates blood flow, activates muscle support, and sharpens nerve communication, all 3 pillars of reliable erections. Now, set the right expectation. This isn't an instant fix. Your body needs time to adapt, but within 2 to 4 weeks, many men notice subtle improvements, more warmth, more fullness, firmer morning erections. Over months, the changes build. Pair this practice with healthy habits, stay hydrated, strengthen your pelvic floor with Kegels, and fuel your body with circulation-friendly nutrition. When these steps become daily rhythm, results multiply. Gentlemen, weaker erections are not an unavoidable part of aging. Your body still has the ability to respond. With consistent pressure point work, you can retrain nerves, restore blood flow, and bring back the confidence of natural morning erections, safely, drug-free, and completely within your control. If you found this valuable, make it part of your routine and share your progress. And remember, your sexual health reflects your overall health. Every step toward better circulation and muscle tone pays off, in the bedroom and beyond.
Your heart will thank you. Together, we can build a healthier America.